the next presenter, I would like to just touch upon one of the core topic is climate change, public health threats, and what challenges, learning, and opportunities we have been arisen at the global level. We would like to hear from Ms. Aleisha Rozario more about it, and thank you.
Let me see if this works. No? Okay. Thank you, Dr. Saima. Thank you for organizing this panel, which is so critical to our times today. And thank you to the government of Pakistan also for hosting this, this event and gathering us all here today. Honorable ministers, esteemed guests and delegates, it's really my honor to be with you today in Islamabad and participate in these important discussions that affect us all profoundly, no matter where we are in the world. Today, I seek to address a matter of global significance that transcends our borders and demands our immediate attention, and that is the intersection of climate change and public health. Given the escalating trend in global average temperatures, climate health will increasingly hold greater significance for humanity over time. It is imperative for us to unite in forums like this, where we can deliberate on various scenarios, pool our collective knowledge, and engage in mutual learning. Through this collaborative process, we can strive to build consensus on potential actions that need to be taken. The year 2022 was the 6th warmest year on record, and this is based on 150 years of data. Strikingly, the 10 warmest years have unfolded since 2010, so with the most recent 9 years, that's between 2014 and 2022, consecutively standing out as the warmest in our historical record. And the forecasts indicate that this warming is likely to continue at this pace. Fueled by human activities such as deforestation, industrial emissions, and the burning of fossil fuels, climate change has ushered in a host of environmental changes, which we'll talk about. The surge in frequency and intensity of extreme weather events, including hurricanes, floods, wildfires, and heat waves, has become more than a mere environmental concern, as it directly impacts public health, leading to displacement, injuries, and loss of life. As we know, many of the worst impacts will be felt by those populations which are already suffering because of multiple health burdens and vulnerabilities combined with poverty and socioeconomic exclusion. These vulnerable populations face compounding challenges in accessing clean water, shelter, and medical care, thus propagating the emergence and rapid spread of infectious disease. Altered climate patterns are further exacerbating the spread of vector-borne diseases, as we've heard about, such as cholera and typhoid. As I sit here today, I'm based in South Africa, and the Southern Africa region is facing multiple cholera outbreaks that we have not been able to contain for the last several years. Efforts to address and mitigate the impact on vulnerable populations. We witnessed how the devastating floods last year had far-reaching impacts, 2022, with the floods damaging crops, livestock, and infrastructure, leading to food insecurity, malnutrition, and enormous economic losses. The government of Pakistan and its partners have provided life-saving assistance to over 6.1 million flood-affected people in 34 districts. However, significant humanitarian needs persist, especially in flood-prone areas where some 3.4 million people out of the 9.5 million targeted remain unassisted. Air pollution, closely linked to both climate change and public health, is another critical concern. The burning of fossil fuels not only releases greenhouse gases, but also produces air pollutants, causing respiratory disease, cardiovascular issues, and premature death. As temperatures rise, the concentration of ground-level ozone, a major component of smog, also increases, exacerbating these respiratory problems. And air quality indices in many countries continue to rise and underscore this phenomenon. For instance, in 2019, in New Delhi, They recorded an air quality index over 900, which is more than 11 times the safe limit set by the World Health Organization. The city was engulfed by a thick layer of smog, reducing visibility and causing breathing difficulties for millions of residents. The smog was attributed to many factors. And similarly in Lahore, Pakistan's second largest city, they faced a similar situation with an air quality index over 500, which is also considered hazardous. So the challenges posed by the intersection of climate change and public health are immense indeed, but we are continuing to face them head on, and in doing so, we have gained some very valuable insights. We've talked a lot today about the interconnectedness of our global community, and that is a crucial lesson. Climate change knows no borders, emphasizing the necessity for collaboration and shared responsibility for the well-being of humanity. The COVID-19 pandemic has also highlighted the importance of preparedness and resilience in the face of health crises, with lessons applicable to the broader context of climate change. So how can we start to think about possible and practical actions? The first step, we believe, is to identify and map vulnerability. This morning, actually, Dr. Brennan mentioned the STAR approach and vulnerability risk assessment mapping, which is one of the ways we can incorporate climate hazards into our health assessments. Because climate health impacts not all of us in the same way. We know that vulnerability to climate health related consequences will be influenced by our geography, our demographics, our biology, and health status, the political and socioeconomic status in which we live, as well as the strength of our health systems. So, as I mentioned, climate-sensitive health risks are disproportionately felt by the most vulnerable and disadvantaged, including women, children, ethnic minorities, poor communities, migrants, displaced persons, and older populations, and those with underlying health conditions. People's climate vulnerability is also determined by their exposure to these threats, by their sensitivity, by their capacity to adapt and assess their assistance and services. We have a chance now, in the face of a global threat, and in the wake of the COVID-19 pandemic that has taught us so much about response, resilience, and recovery, to truly reorient our health action and health service provision around the needs of the most vulnerable, whose multiple concurrent burdens and risks also contribute to the overall population vulnerabilities. As we confront these challenges, there are also opportunities to transform our healthcare systems through sustainable practices, investment in renewable energy, and integration of climate resilience into infrastructure in order to build a more robust and adaptive healthcare system. As we've heard, Dr. Saima, Pakistan is at the forefront of developing many of these policies and initiatives, with the National Adaptation Plan as one example. But I want to also highlight examples from the region. In Bangladesh, a low-lying country that is highly vulnerable to sea level rise, flooding, and cyclones, the government has implemented initiatives such as constructing climate-resilient health facilities, development of early warning systems, training of healthcare workers on these systems, and the provision of mobile health services to respond rapidly. In Nepal, similarly, a mountainous country that is prone to landslides, avalanches, and glacial lake flooding, the government has taken steps to improve the climate resilience by establishing a climate health unit and integrating climate change into all their health policies and plans. Another important area is promoting public awareness and education through risk communication and community engagement, which will equip communities to adapt to these changing environmental conditions and protect against health threats, and advocate for policies addressing both climate change and public health. Communities armed with knowledge are better prepared to navigate evolving environmental conditions, shielding them from health hazards and actively calling for responsive actions from their governments and leaders. The transformative impact of public awareness and education extends to behavioral changes that can curtail greenhouse gas emissions and contribute to the broader effort to mitigate climate change. As we convene to review our global health security agenda, we need to adequately plan for these climate-related threats, both at the global and country levels, and establish these resilient health systems that can prevent, detect, and respond to these threats. It is time that we integrate and ensure that core services, environmental sustainability, and climate resilience are central components of universal health coverage and primary healthcare systems. There is an opportunity to innovate and to introduce cheaper and reliable solutions, as well as mainstreaming climate resilience into the fabric of our health systems today. We will need to support research and innovation for climate-friendly, resilient tools, and we will also have to train and capacitate our workforce with the appropriate knowledge, competencies, and tools to face climate-related health problems. Not once-off trainings, but rolling out continuous support using after-action reviews, simulation exercises for simulating outbreaks and other health hazards are key to supporting continuous workforce development. Along with assessing country-level vulnerabilities and risk, collectively these components will need to be integrated in climate-informed surveillance systems and response plans as a crucial way forward. In conclusion, the challenges posed by the intersection of climate change and public health are indeed substantial, but they are not insurmountable. The lessons we've learned, particularly from the recent global crisis, have equipped us with the knowledge and tools to forge a path forward. As we confront these challenges, we must also recognize the opportunities for positive change, from transforming healthcare systems to fostering public awareness and driving innovation. As we strive to achieve the Sustainable Development Goals by 2030, it is incumbent upon us to act decisively and collaboratively. Our actions today will determine the world we leave for future generations. Let us seize this moment to build a healthier, more sustainable, and resilient planet for all. Thank you very much.
Thank you, Aleisha, for very comprehensive points that you have highlighted. I would like to touch upon one thing that you have very intricately mentioned, that whenever we have to look at climate change and health impacts, we have to look at its two dimensions. One is environment and other is climate change. So we cannot we cannot close one eye and see the problem, but we have to open both the eyes to see both the dimensions, that how environmental degradation is contributing towards the climate change and how climate change is aggravating the environmental degradation.